Okay, hello everyone. I think we're live now. Had a little bit of a false start there. Sorry we're on your end, I guess, a few minutes late. I'm sorry about that. Experimenting with our YouTube technology here. In case you missed the intro, my name is John Lustrea. I'm the Education Coordinator at the National Museum of Civil War Medicine. Thrilled to be joined today by Mark Breazzano, MD. He's an Assistant Professor of Ophthalmology at Johns Hopkins University. Thank you so much for being with us today, Mark.
Thanks so much, John. Real pleasure to be here as well, and really welcome the opportunity to talk with you on this exciting topic.
Yeah, so we're going to be talking today about how Civil War medicine impacts us today. Now, myself and Jake and the other people here on staff, we are historians by training, but I often like to say we play doctor. I'm not a doctor, but I play one on TV. But today, I don't have to play one on TV. we have a medical doctor with us. We have a lot of doctorates of philosophy on this channel, but we have a medical doctor with us today, and I think this is going to be really exciting and interesting conversation to show how, while the Civil War was 160 or so years ago, it's still, the medical care still kind of impacts us today. So it's going to be, I think, a really, really interesting conversation. If you have any questions at all throughout the presentation, go ahead and drop them in the comments, and I'll be sure to pepper those in throughout our conversation. Quickly, just to get us started, if you enjoy programs like this, we've been doing them for over a year now. Consider liking the video, share the video so more and more people can see these. It helps us out a lot, and that's something that is totally free. You don't have to pay any money to do, and it helps us out. So everybody wins. And then if you want to take your support to the next level, you might consider becoming a member of the National Museum of Civil War Medicine. Memberships start for as low as $25 a year, and they, again, help us out immensely. It gets you free admission to the museum, discounts in the gift shop, access to our newsletter and journal, and all of that good stuff. So that helps us out quite a bit. And just going to the comments, I'm seeing a lot of familiar suspects there. Barbara Schultz, Greg is here, Gary from Ellicott City, Maryland, Robert Lustrea from Illinois. Let's see, Mike Cohen's excited to learn about the subject. Bob Smith in Central Florida. So we got all kinds of people, and I see we have Fernando from Venezuela tuning in. So we got people from all over the world tuning in with us. So it's always fun to hear where people are watching from. So great stuff. So Mark, to go ahead and get us started, why don't you maybe say a little bit about yourself, how you came to medicine, and specifically how you came to be interested in medical history?
Yeah, thanks, John. I'm really excited to be here with us. I basically, I've done, starting in college, I've been doing research specifically on the visual system. And from that point, kind of was a launch pad for me in the medical school. I've always been interested in the research aspect as well as the clinical side of medicine. And really just, I think it's important to really advance our field and our understanding of medicine and surgery, not only by looking ahead, but really understanding where we came from, because a lot of these concepts, they keep popping up over time and the trajectory of everything that we do. My specific subspecialty is vitreoretinal surgery, which is the back part of the eye. So things like retinal detachment repairs and whatnot. And even though my specific field is relatively new within the last few decades based on advancements that we've had technologically, it really has the foundation based on other sorts of principles that we have from our neighboring fields, including general surgery and hand surgery, which is a similar type of microscopic surgical subspecialty, as well as plastic surgery, which really came out and was born out of a few of the wars that really America was part of in the early part of the last century.
Yeah, that's such a great point about even though it doesn't seem like an obvious connection, so much about, medical progress, you can be really, really informed by where we've come from. So I think that's a really great perspective to have, and certainly why we love having you around the museum. So that's how we got connected. Mark came here
Yes.
for a visit, and we really hit it off, and so we appreciate you coming in.
Oh, definitely, John. And yeah, to go off a little bit on that part, really got interested in this part of things. As you mentioned, kind of coming into the museum a couple months ago, I had heard from some friends and family of mine of how great the museum was, and so obviously I had to see it for myself. And in the town of Frederick, there, actually one of my practices, my office is actually in Frederick, and so I had certainly a keen and local interest in this as well. And it was fantastic. Anyone who hasn't already, it's definitely worth a visit. The material that's inside there, I learned a lot myself, and it's really humbling to just see how much information and progress and what we've understood from the Civil War. And even moving on, I thought the new exhibit, especially how it relates to modern medicine too, at the end of the museum, which my understanding is one of the newer exhibits there, is really helpful for helping my own education, and also the connection that we had as we visited and really enjoyed it.
Excellent, and we didn't even pay him to say that either. So yeah, come on in and come pay us a visit. We're open Friday, Saturday, Sunday for walk-ins. And I see that Gary here in the comments, he said he just became a member this week. We really appreciate that, Gary. That's excellent. And I saw somewhere Robert saying he needs one of these hats. This is just a prototype, but the goal will be to have these on sale before too long. So if you really like the polo's currently on sale. So anyway, you can come in and become a member and get a discount off some of this stuff. So splendid. Well, let's go ahead and get into the topic here. When we were kind of having a conversation about this, I had asked you, what ways, because, again, for a lot of people today, I think Civil War medicine feels really arcane and old, and there probably isn't much that we can kind of learn from this, or that not that many ways that it impacts us today. And you kind of outlined 4 different kind of areas where there's, I think, a lot of relevance to today from Civil War medicine. And the first, quite topical, would be vaccines. Believe it or not, they did have a vaccine at the time of the Civil War, and that's for smallpox. Do you want to go ahead then and elaborate on that, Mark? The connections between then and now.
Yeah, absolutely. So the vaccine, as you mentioned, the smallpox vaccine was the one that was being used at the time. And, similarly to now, it's interesting how, one of the issues that seems to be a big issue is, even though there is data and knowledge that it works for reducing the spread of infection, as we know, there is what's been called vaccine hesitancy now, in terms of people, being skeptical or uncomfortable with taking the vaccine for a variety of reasons. What I found was interesting was that, and this is some work of my colleagues here at Johns Hopkins that have outlined it, is that, today we're calling it vaccine hesitancy, but it was actually a stronger term back then. It was called vaccine resistance for people that didn't actually take the vaccine. And John, don't correct me if I'm wrong here, but it seemed when I was looking, there was actually some, in some cases, some stringent regulations that actually mandated people to get the vaccine, which, I think would, in some settings here in the States, would actually cause an uproar if we absolutely mandated it in some cases, although some universities and whatnot are sort of requiring that for students enrolling and whatnot. Is that what you kind of came across as well?
Yeah, so the smallpox vaccine, and while we are going to make a lot of connections between Civil War medicine and modern life today, let's all be thankful we live in the 21st century. The smallpox vaccine was pretty imprecise in this sense. So it comes from, basically the scab from, from a cow. And I'm not entirely sure exactly how they kind of connected the dots, but basically they sort of cut a hole in your arm and they just kind of shove it in there. And it proved to be effective at preventing smallpox. And at the time of the Civil War, if you were going to enlist in the Army, the pre-screening physicals that they would have given soldiers were pretty imprecise and not very thorough. But one of the things that was required to speak to what you were just saying there, Mark, was that you had to be vaccinated. Now, at the time, today, we have vaccination cards and things of this nature that, there's kind of a paper trail. But at the time of the Civil War, to the extent that there was one, a lot of cases, they would just have to take soldiers' words for it. And so this vaccine resistance that you're talking about was much easier to deploy. People could just say, oh yeah, I definitely had it. And there's no form of proof really that's around. And at times that would lead to smallpox outbreaks in the various armies. And we've become very familiar with the word quarantine. That was something that happened quite a bit during the Civil War. Whenever there was a smallpox outbreak, they knew enough to just like, okay, we're just going to put you over here. And that. So yes, you do see a lot of that during the Civil War, this requirement.
Yeah, no, it was so fascinating. I think that's what actually took me most when I first came into the museum and saw that as soon as you get up to the second floor is one of those original documents showing, did you get your smallpox vaccine or have you previously been infected with smallpox? And I thought that was really telling, about that time. And what's interesting too is at the heart of the vaccine resistance, some people, as you described it, it sounds quite barbaric, right? We don't do the same thing now for our vaccines. Or if you do, you should alert your primary care physician. But what's interesting is, they had that kind of resistance, and some of it was, oh well, it's coming from a certain animal because they'd use, the cowpox and whatnot, these related sort of viruses. And there's these really great cartoons of horns coming out of some guy's head as like sort of this artistic rendition of not wanting to take the vaccine and trying to tell other people not to do it. And then today, there's all the skepticism with mRNA. Even though then we didn't know about the germ theory that much, we knew it worked. And today, mRNA, the sort of the genetic aspect, which is sort of a new type of methodology for these vaccines, has a lot of people that are skeptical. And so that kind of raises a lot of concerns for people taking the vaccine now, even though the evidence has been building up and showing how safe and effective it is. And so I thought that parallel was quite interesting too. And I think, as you were getting into quarantine, I believe that might get into our sort of next topic as well too, but wasn't sure if you had any additional thoughts there, John.
Well, yeah, just kind of building off what you just said about how there's, so at the time of the Civil War, we're about kind of roughly 10 years away from the discovery of germ theory. And so they don't quite totally understand why it works, but they know that it's effective. And the fact that it's effective is good enough for a lot of people. But so there's kind of that parallel between there's some confusion, I guess, amongst a number of people for why exactly it works, and that perhaps contributes to some of that. But the results are the thing that continually gets underscored by its supporters. So that's another kind of interesting parallel, and that they're very much aware about how the spread works, how the spread of disease works. Again, even though they don't understand exactly why it works.
Yeah.
So it's that kind of connections, the connections that get made, there in that regard.
Yeah, it's fascinating. Oh, sorry.
Well, no, you go ahead. I don't want to keep going in that line of thought.
Yeah, no, and it's sort of like you were mentioning before we went on air too, the Civil War just kind of barely missed it in terms of, the advances with the germ theory, with the, Pasteur, Lister, all these all these legends in the field of medicine, making these pivotal experiments around the same time. And it just didn't seem like, obviously could take advantage of, the advancements in antisepsis and, in control of, preventing these infectious complications during the war.
And I just want to give a shout out to our ever knowledgeable viewers. Anytime, this has happened quite a bit as we've done our videos, anytime I'm struggling to remember something or I'm not sure about something, they're always right there with the comments to help point me in the right direction. The connection was made between the cowpox and the smallpox vaccine. People started noticing that dairy maids rarely got smallpox, and that's kind of how they initially formed that connection. So thank you to Nakia Jackson. Appreciate that chiming in the comments. Yes, something that I think this, the kind of putting the pieces together, as it were, that leads us to another of our subjects that you brought up is the whole idea of this kind of continual attempt at learning going forward. So during the Civil War, the Surgeon General of the United States Army, William Hammond, kind of is adamant that there's going to be the Civil War will be a great learning experience. And actually, we've had a number of people comment kind of on this. Where'd it go? These weren't legal at the time of the Civil War, so nearly all surgeons saw the inside of the human body for the first time, taking care of the wounded. Dissections and such were only legal with the bodies of convicted criminals and things of this nature. So some doctors had seen the inside of a human body, but not many. And William Hammond wanted to take advantage of this. And so he issued something called Circular Number 2, which created the medical and surgical history for the War of the Rebellion, a collection of, quote, interesting samples. And so we have this incredible knowledge, things like that. So there's that building and expansion of knowledge that happens during the Civil War.
Oh, John, I think I'm losing you a little bit there.
I do not know what just happened there.
Oh, okay. Yeah, we can probably just pick up where we left off, right? I think you were talking about, with the...
Yes, the expansion of knowledge. I think we're back, actually. So sorry about that, everyone. Dropped out there for a bit, had some trouble with the Wi-Fi. But I think we're all back on here. So thank you for bearing with us. But I'm not sure where exactly I cut out, but I'm talking about the Civil War as, this expansion of knowledge. Civil War General, or the Surgeon General of the Union Army, William Hammond, issues Circular Number 2, which will result in the publishing of the medical and surgical history of the War of the Rebellion, which you can find free online today. It's just a listing of case studies from Civil War soldiers. It's this immense learning opportunity. There's all kinds of data that's collected and still accessible today. But so anyway, Mark, you had identified when we kind of created this outline, the idea that, we can pick up a lot from Civil War medicine with this kind of obsession with always learning and moving forward.
Yeah, no, I think you brought up some really good points. And it's really interesting, the fact that how you mentioned a lot of these surgeons and medical professionals have never seen the inside of a body, and there are all these sort of stigmas related to almost desecrating the body just to understand it more. And correct me if I'm wrong, but I feel that in even in medieval Europe, that was a huge problem. Like they were, for over a millennium, basically going by what Galen was saying with the humors of the body. And it wasn't until Vesalius who, was able to actually look inside, these bodies and more accurately depict the anatomy of what was actually going on. I mean, that was basically, it was a standstill for understanding that. And, there are certainly parallels even today for numbers of reasons, whether it's religious or moral or any other kinds of decisions. In some ways, much of our progress, which we have to make sure is still ethical, there are concerns with how, let's say, we're advancing with stem cell or gene therapy type of research. That's been a hot topic and very controversial, with quite a bit of promise, for advancing diseases and treatment that were previously impossible. And so I think it'll be exciting, especially as we move forward, as we do that. But of course, doing it in the most ethical and cautious way that we can. And then, going back to, again, more to learn, there's, the thing with anesthesia at that point, there was sort of these myths that, they could just get the soldiers drunk and that was it they had for anesthesia. But something I learned from you, and it's even in some texts in different places, that the anesthesia was poor during the Civil War, but that was actually not the case. And so I think, correcting that sort of misunderstanding will obviously be important. But anesthesia has certainly come a long way. We have all these different agents to use. When we're doing surgery now, over the last several decades, even many of our eye surgeries, for example, are same-day procedures. But even just a few decades ago, many patients, even for a cataract surgery, would stay in the hospital, sometimes for days, or even retinal detachment. They would stay there for weeks at a time. And we found out later, and it was actually one of the pivotal faculty here at Johns Hopkins, actually found that the risk of dying and having mortality from that was increased by having them be bed rest in the hospital for days or weeks at a time. And so that paradigm has now shifted where, we'll repair a retinal detachment and they'll go home the same day. So we're constantly advancing the way that we approach these surgeries, and there's still a ways to go. Even just an elective surgery, it's not unheard of. Thankfully, it's rare, but it's not unheard of. That's still happening with people dying during anesthesia, even today.
Yeah, thank you for mentioning the anesthesia bit. That's one of the most common kind of myths that we bust here at the museum, that well over 95% of all Civil War surgery used anesthesia. We're talking chloroform and ether, so not exactly what we use today, but it was very pervasive, and they went out of their way to make sure that it was pervasive. Even in the Confederacy, which was famous for the kind of general lack of supplies relative to the Union Army, they made sure to establish anesthesia production factories in several major cities, in your Atlantas and Richmonds and places like that. So yes, so that anesthesia point is important, and the kind of attitude of the doctors, not kind of being beholden to the way that things were done, and kind of moving forward in that sense. And I think it's kind of an unusual thing for people to hear, but the Civil War is actually the very early days of the kind of intensive application of the scientific method to kind of medical experiments, questions, and problems and things like that. The scientific method is pretty ubiquitous in school, science school programs today, but it's actually a relatively recent thing, forming a hypothesis and trying to collect data and observation. That's what the medical and surgical history is. It's just a massive compendium of observations and such, of patients and case histories, and you can go and look this up, today. And that's where we get so many of our numbers from, like that 95% number that I just cited about anesthesia. So yes, the application of the scientific method and kind of documenting, the process. It would be interesting. You talked about the, moving forward ethically. I'm not necessarily trying to suggest that they did anything ethically dubious, in the production of the medical and surgical history, but, it's occurring to me that I don't know what they might have thought about the ethics of, the expansion of medical knowledge during the Civil War. I can't really speak to that, but it's getting me curious to know what they might have thought about that, if they would have been the same as, comparable to us, or totally different. I don't know.
Yeah, no, it is. It would be great to, if we could go back in time and interview these folks. I mean, it's, the physicians then we do know the educational background is a little bit different than it is now. Obviously, predates the Flexner Report of the early 1900s, where it sort of mandated kind of the long training that is usually required now. And, back then, like we were mentioning before, it just barely predated the germ theory. And at least from my reading, it seemed that, a lot of people were resistant to a lot of these ideas. I believe it was Wessel, who was a Central European physician and did a lot of the early work, where he noticed that the midwives had lower infection rates or puerperal fever in their wards with patients giving birth compared to the physician wards. And he found that it had to do with hand washing, and just the simple act of hand washing really decreased the rate. And none of the colleagues or the rest of, the community really seemed to really support this, basically radical idea of his in Europe. Like, surgeons would go around with unwashed clothes as like kind of badges of honor. Like, hey, look how much experience I've got cutting, into patients. And so he's sort of ridiculed for it. And I think I read too, it drove him crazy, literally, and went to an asylum where he ended up dying because of a lot of this. And so, and I think there are sort of parallels now, really transform the field. Not only can it sometimes take a while for the public to get on board, but also the rest of the scientific and medical community can be very hesitant itself in terms of accepting sort of ideas. I mean, certainly you want to have some healthy skepticism, right? Because certain ideas really aren't actually safe or effective, and they do warrant additional study. So it's certainly that kind of give and take that I think is always going to be important, and just making sure we're doing a thorough job, but also, making sure we're taking all the appropriate measures and efforts to make sure that we are constantly improving and really closely examining how we're doing things and improving the process.
Yeah, that give and take that you're talking about is, we see that, in the years after the Civil War. So these same physicians who during the Civil War are kind of laying so much groundwork for all of this, these new specializations, like specializations on nerve injuries, what goes on to become plastic surgery or facial reconstructive surgery. I mean, cardiologists and things like that. All these specializations get created, but when germ theory comes around, they're intensely skeptical of it. And my colleague Jake does a great program, which you can find on our YouTube channel, called "How Civil War Medicine Killed President James Garfield in the 1880s." Because when he's shot, in the assassination attempt, he's treated by a Civil War surgeon, and they're using kind of antiquated techniques, which would be very familiar to a Civil War surgeon, and he served during the Civil War, but they weren't in keeping with germ theory, which was really coming around by that point, but he hadn't quite bought into it. So, it's amazing how even the same people can go from let's really push the boundaries of the field to maybe let's not do that, let's stick to the old ways. So it's kind of fascinating how cyclical that can kind of become sometimes.
Definitely. And continual education, no matter what profession you're in, it's always important to just kind of keep up with what's developing, and I think that is a prime example in our field, how it's always important to, experience is important, but also making sure that we maintain, our knowledge base is current with the standard of today.
Yeah, it's a tough balance to strike.
Yes.
And something to another one of our main points here, a way in which the Civil War, I think, should be looked to in a much more direct way, has to do with the prevalence of supplies. And this is something that you've written about and been published about, talking about the distribution of PPE at the start of the pandemic, and what to put it nicely, what a challenge that was. So maybe speak a little bit about the piece you published and what historical precedent we might look to for that.
Thanks, John. Yeah, no, it was certainly a challenging time for all of us, and in some ways, I'm grateful to have had the experience being in New York City at the time. So this would have been last March and whatnot, when this really outbroke there. And really, we didn't understand too much about the disease and COVID at the time. And so obviously we know about germ theory and how viruses spread, but every virus is a little bit different in terms of how contagious it is, how infectious, the severity, and people can react differently, different comorbidities. But beyond that, we, like you said, we didn't have what's called PPE, the personal protective equipment. So things like the N95 respirators and masks. And so a lot of the hospitals were very ill-equipped with this. And my particular research was looking at, it seemed, among colleagues within ophthalmology and other fields, it seemed, at least anecdotally, that there was a difference in terms of who was getting infected. One of the faculty at NYU was actually hospitalized in our department and was in the critical care unit for several months after being infected. And I believe two of my co-fellows, before I finished my training, had actually been infected as well. And so it seemed like it was a little bit higher rate compared to, friends and colleagues in other fields. And so what we did was we actually stratified and sent out a survey to resident trainees throughout the greater New York City region with certain questions, including PPE, as well as presumed infection rates. Now, also, in addition to the PPE, the amount of testing was limited. So there were only a certain amount of tests that were actually around. And so this is kind of maybe loops back to the Civil War a little bit, where the supply lines for all these things are really critical. And, just identifying and being able to quarantine is really important. So then that way you can kind of contain the disease. And though that ability was very limited, for example, my co-fellow, even though she had classic symptoms, loss of smell, cough that persisted for at least a couple months, she was just simply told to go home and sort of wait it out. And there was no test available for her. I think this really kind of hurt, at least in the beginning, what we were able to do. And eventually we were able to ramp it up in terms of production, because again, a lot of that is done, at least in the beginning, overseas, and the US wasn't really primed to do it at this time for a variety of reasons. Some are probably political and beyond the scope of this conversation. But regardless, it's and what we found was, how basically specialty dependent. There was a specialty dependent risk. So things like anesthesiology, putting down breathing tubes down people's throats, and emergency room physicians, that are intubating and sedating some of these patients. Our field in ophthalmology, head and neck surgery, the otolaryngologists, anyone with sort of close contact with head and neck secretions, we found were actually higher rates of infection from COVID compared to other ones. And so using this data, we had direct evidence that, at least with what the PPE we have, at least making sure that we can supply enough for, especially for these procedures and interactions, not only for the physicians and staff within those fields, but for the patients too, to make sure that we're not transmitting disease between either party. I mean, is really going to be critical. So even though it was just for this pandemic, which we're hopefully exiting soon, and it seems reassuring at this point, but at least it can help guide us in future pandemics, whether it's COVID related, flu related, whatever related. And I think that's really going to be helpful. And something I felt that was extremely striking, just walking through the museum and just learning how, the crowding of disease, speaking of, proximity and quarantining that we were talking about before, is just a sheer volume of soldiers that died in the Civil War while they were sitting in different camps, in the waiting for battle or moving to a battle and whatnot. Just those close quarters of these diseases quickly spread. And it's just so important when it comes to, quarantining or social distancing, which I'm sure all of us are just sick of at this point, literally, but it is actually important for containing the disease and just making sure, to a certain extent, that we're doing everything we need to keep us safe. And I think this is just one of those things where we just really need to keep that in mind in terms of the big picture. And it just, going back, what would these physicians or other healthcare professionals think at the time, if you were to interview them? And it's just mind blowing. Like, miasma, the theory of a bad air kind of carrying and transmitting the disease, or it was some type of divine intervention for someone's sins, as the harbor vector for the disease. It just, it's definitely a different way of thinking than I think many of us would sort of agree upon today.
Yeah, and there's just so many variables with all this sort of thing. In fact, our very first comment on the program, there was someone talking about their ancestor who was wounded during the Civil War, pretty severely, I think in the lungs, and ended up living to be 93 years old. And they asked open-endedly, good medicine or good genes? Hard to say. I mean, but yeah, there's a lot of great threads in there. First, about the supplies. In many ways, the early days of the pandemic, especially in New York City, in a lot of ways resembled kind of the early days of the Civil War. Just suddenly so many, sick soldiers who were from rural areas and hadn't come into contact with all these diseases when they got to more urban areas, when they were mustering in. And suddenly, like you said, they're around all these people. Suddenly there's lots of people that are sick. Eventually, after battles happen, there's thousands of wounded, and suddenly they're like, we don't have any place to put these people. So, I mean, it's certainly for that sort of resemblance. And this sudden and almost immediate need to dramatically scale up the supply production and things of that. And that is something that, especially in the North, the Union Army was able to do. But I think the Civil War makes it, immensely clear the importance to be able to quickly scale up supply production. And that was something that I think the early days of the pandemic laid bare. Even if we're not constantly producing, as much, PPE as we are or were recently, the vital importance of being able to quickly scale up to be able to produce that much should it be needed. That need became very apparent. And yeah, I mean, working here at the museum, there were all kinds of parallels in those early days. Suddenly it's just, it's everywhere. Space is at a premium, in ways, especially with the whole idea of social distancing and stuff. I mean, maybe you can speak to what a challenge that was in some of the hospitals where you were working in the early days. What was it like trying to find space?
Yeah, you're absolutely right. I mean, it's just so many challenges, not only from the PPE and then the social distancing that we know is important, and especially in these bigger urban areas in New York City where real estate is already at a prime value there. And the thing is when there are patients that need to be seen too, what we found, at least in, sort of in the clinic and the hospital, is trying to maintain those same measures in already very tight locations. And so it's definitely been a real challenge, making sure for a variety of diseases and conditions, these patients are coming in and making sure that we have the appropriate amount of space to keep them safe and not contract something like COVID-19 while getting taken care of for, a disease unrelated or related to it. And so it's certainly something that I think we've all sort of started to learn to navigate, and then certain precautions have been taken, as a result of this as well. So in terms of other types of distancing, when somebody with COVID or presumed COVID is going under general anesthesia, for example, typically people will exit the room, in the operating theater while they're getting intubated or extubated during that aerosolizing procedure. There were cases of, despite N95 masks with everybody in the operating room, in patients with, surgery above the neck, where they were actually, all these healthcare workers were contracting COVID just from that one case. And so they were able to find, based on these different cases, some with more data than others, they're able to actually identify certain measures, including social distancing or other types of distancing like this, to really adapt to what we can do to really protect everyone involved. And so I think, I think some of these are just minor adjustments and not too inconvenient, whereas others are certainly a little bit more challenging, but equally as important to really make sure that we do. And I think everyone will be relieved when we can get back to what we call, quote, normal, I think.
Mm-hmm. Absolutely. And all those adjustments, which I think it's easy to lose sight of when you're in the midst of the inconvenience of them. But, all of these sort of adjustments that you allude to are in the service of, really saving lives. And an example, from the Civil War, I mean, they're starting to kind of put the pieces together with germ theory. They don't quite get there, but in Civil War hospitals, they start to notice that, cleanliness seems to be related with better patient outcomes. And so as they're able, they require the patients be bathed every day, the clothes cleaned every single day, and the bed sheets cleaned every single day. Again, they don't necessarily know why this is effective, quite in the same way that, we could understand why some of these measures that we were taking were effective were. But they require it to happen all the time. And likewise, they notice that good airflow, seems to be related with good patient outcomes. So they, required that to happen as well. So, I mean, all of this is, in the service of, saving lives and, contributing to good health, as, inconvenient as it can be sometimes.
Yeah, it's really interesting just to, think and realize, looking at the data, how much just antisepsis really can help with these outcomes and prevent these infectious complications. I mean, penicillin didn't really come around until even decades after that. And yet you can already see such a dramatic improvement in these just, even before that era.
Mm-hmm.
I mean, you tell me, would that maybe we still just would have needed penicillin for George Washington, with his kind of throat infection. But I don't know, antisepsis would have helped him, but at least, certainly in Civil War, this would have, right?
Oh, immensely. Kind of like you alluded to, 2/3 of all Civil War deaths result from disease and not battlefield injury. But part of what gets kind of folded into that's hard to kind of separate is infection. Infection from battlefield injuries. It was thought at the time of the Civil War that pus was a part of the healing process, and you would either have good pus or bad pus, or what they would have called laudable pus, or bad pus. And basically, what we know today, it's whether you have a more serious infection or a less serious infection. So basically, everyone that has amputations done or any kind of surgical procedure, because no one's washing their hands, the vast majority do get infections. And a number of them pull through, and they do fine. And well, like the one example that someone commented earlier, the person lived into their 90s. I mean, that's not uncommon. somewhat miraculously for, people who were casualties during the Civil War. But for those that didn't, where it's sort of a gray area, the listing of death would be either as a result of, the battlefield injury, the amputation didn't go well, complications from the amputation. But in some cases, it would be weeks afterwards. Sometimes they would be in a different hospital and they would have just identified this as a different sort of disease. So these numbers on like the mortality rate from infections are very fuzzy because they just don't quite have the language to describe what an infection is. So, like you're saying, would antisepsis have helped this dramatically? The answer is yes, but it's hard to kind of be able to put some numbers to it. One example we do have, though, is a successful application of the scientific method. Dr. Middleton Goldsmith in Missouri, I believe. He's doing some experiments trying to treat hospital gangrene, which had a mortality rate of about 50%. So, I mean, if you had if you had gangrene, you probably weren't, you had a coin flip to make it through. There really were no effective treatments for it, but they're throwing things at the wall and seeing what sticks, again, in the service of helping people get better. And so what he discovers is by basically just dumping bromine on the open wound, incredibly painful, but it's basically kind of killing the germs there. When that treatment is applied, the mortality rate goes down to about 2%. So that's just one example, well, really the only consistent example that I know of. And regrettably, that only gets discovered towards the end of the war in later 1864. But that's just one kind of concrete example how, they're kind of heading in that direction, and it proves to be immensely helpful. So it would have made a huge difference, but exactly how much, it's so hard to quantify.
That's so interesting. And I remember reading, at least with Lister in Europe, when he's doing his work and considered one of the fathers of surgery, he was using carbolic acid, right, with phenol, and he was seeing something about the sewage on the yard, like on the grass, from the cows and whatnot. Like that was where he got that idea. Was Middleton, was he informed by this, or were they kind of independent, do you think? Or how do you think that kind of arose around this? I mean, because I believe that was a similar time, right?
A similar time. From what I know, they were unrelated. I'm prepared to be wrong about that, but from what I understand, it's unrelated. It was more so arose from the situation. We have a lot of cases of this. We got to try something, and they're just kind of running through, the listing of things that, they think might have a chance of helping. And over time, the data they collected showed that it, led to better patient outcomes. So they just started doing it all the time, and it proved to be effective.
It's really fascinating how, look through different eras of science and medicine, and oftentimes a lot of investigators will sort of independently or simultaneously kind of come up with these sort of ideas that actually do overlap in different ways. And I think it's really impressive how it was sort of that. And like you said, it's really tragic that it didn't happen sooner.
Mm-hmm. Indeed. Now, we'd be remiss if we did a program like this connecting, kind of Civil War medicine to modern medicine without mentioning Jonathan Letterman, one of the many patron saints of the museum here. Letterman is medical director of the Union Army of the Potomac, and he is sort of the brains behind the ambulance corps during the Civil War, as well as the system of care that is designed to evacuate wounded soldiers from the battlefield and ensure that they're cared for from the moment they're injured all the way through long-term recovery. And we talk about that extensively here at the museum, but that same skeleton, that same structure of battlefield evacuation and the pervasiveness of ambulances whose job it is to quickly get people into hospitals, that's still with us today. Do you want to say anything about that, Mark?
Yeah, no, I thought it was really interesting learning more about that. Part of my work was down at Bellevue Hospital, which has one of these early ambulances. And I guess when I had first come to the museum, it was really intriguing to see, where a lot of the birth of the ambulance had really come from. And remember having a discussion Well, is there that there is a little bit of controversy on like where did the first, civilian ambulance actually come from? Was it in New York? Was it in Ohio? And do we actually have more information on that? Because sometimes one place will claim that they invented pizza, for example. You don't know who to believe. So
right, yeah, I don't think we have any more clarity on that front. Although we did just put in a tiny little kind of display in the lobby of the museum, talking about that and kind of alluding that a number of people claim to have put forth the first civilian ambulance, and kind of drawing that line from Civil War ambulances and such to us today. But
okay,
yeah, it's hard to know with these sort of things sometimes.
yeah, no, that's good. It's good that we've got fact checkers though looking into this.
Absolutely. So I hope, as we kind of draw to a close here, I hope that we've been able to kind of demonstrate that, Civil War medicine, even though it's certainly not modern medicine, the lack of knowledge of germ theory disqualifies it from that. But Civil War medicine, I think, has a lot to say to us today, and we benefit from a lot of the kind of foundational work that's laid during the Civil War, as we've been talking about here today. So, I hope that, you've picked up on some of that and you've found it interesting in that regard. If you enjoy this video and all of our videos on our YouTube channel, go ahead and like this video, share the video, subscribe to our channel. That way you get notified anytime we post something, we post any videos. So that all helps us out immensely. And if you want to take your support to the next level, consider becoming a member of the National Museum of Civil War Medicine. For as low as $25 a year, you get free admission to the museum for a year, discounts in the gift shop, and more. So all of that helps us, and it supports programming like this. So we really appreciate all of that, all of you out there watching, and we appreciate you, Mark. Thank you so much for being with us today.
Thank you, John. Really appreciate this opportunity, and it's been wonderful having this conversation. Thanks again, and thank you to all of our viewers.
And we'll be back with you next week, next Thursday, I believe it is. Jake will be on location for our On Tour series, talking about medical care during the 7 days battles. So that's going to be an exciting one. So I hope you tune in for that. Until then, stay well, everybody.